So yes, we do use a couple of tests and mostly screening tests for our clients. And often we get questions from them regarding what does it entails, how does it work, how much radiation you get from the test and things like that. And I think it would be nice just to go through a couple of basic tests today, just in general terms, so that people can understand what it's about. And then we can maybe talk a little bit in more depth about certain tests that we use in the practice. So I think let's just start off with what tests are available and more or less what do they do and how do they work.
Well, in radiology, you basically use three types of energy: sound energy for ultrasounds, electromagnetic energy in CT and X-rays, and then magnets, the strong magnetic fields in MRI. And the radiation dose is really only with X-rays and CT. So that's high energy photons get shot through the body and absorbed by a detector, and that's really the only risky test that we do. In parentheses, risky. Everything is a risk. You just have to look at the dosage. With ultrasound and MRI, really very safe, except for maybe perhaps the strength of the magnetic field if somebody accidentally brings something metal into the enclosure. But ultrasound and MRI are very safe. So if you talk about radiation dose, I mean, most people won't have a reference value. And the units we use to measure radiation is called the Sievert, and the levels that we deal with is Milli-Sievert. And to just give you a reference, the amount of radiation that you would get just living for 1 year on this planet is about 2.4 Milli-Sievert, and which is about the same as you'll get from a coronary calcium score. If you get an X-ray, it might be 0.2 Milli-Sievert, mammogram at 0.4, and obviously CAT scans and angiograms have significantly higher doses.
So that's actually quite little. It's a lot less than people think, or even I thought up to now.
Yeah. People often CT scan is 40 X-rays or 80 X-rays, and that sounds a lot, but an X-ray is actually a minuscule dose, and the risk is really extremely low. But you always, with X-ray, we have the principle of it's called ALARA, as low as reasonably allowable. So we always trying to keep the dosage as low as possible, and we wouldn't image somebody with ionizing radiation if we don't think there's going to be a benefit from it. And that's very important with the screening. We won't just send anybody off the street and says, let's say I'm concerned I might have a pancreas cancer, can you do a CT scan of me? There's no evidence that the risk after the benefit outweighs the risk, and we wouldn't do that. If he says he wants to get scanned for an MRI scanner, we might tell him that the financial risk doesn't outweigh the benefit. But if he wants to do that, we will discuss that. But at least there's no medical risk.